And welcome to Sugar Talk with Dr. K. Gene Lucas and brought to you by Diabetes and Endocrinology Consultants. Good morning, doctor. How are you?
Good morning, I'm great.
All right, what are we talking about today?
We're talking about preventing heart attacks.
Now, probably people don't associate that with diabetes, but and I've only learned this year that it's what is called a heart equivalent or heart disease equivalent.
Yes. So what they're saying is if you have diabetes, you have heart disease, which I'm not sure that's really true on everybody, but it sort of makes you think about the heart more when you have diabetes and you want to prevent having a heart attack. Or a heart attack to me is damage to the heart from the blood vessels being closed off. So you don't want any plaques to build up in your arteries, and you want to keep them clean and healthy your whole life.
But you do see heart disease in a lot of diabetic patients.
For sure. That's the leading cause of death. And in fact, in the United States, heart attacks or heart disease is 1 out of every 4 deaths in the United States is heart disease. So the only one that kills more people is cancer. And a lot of the heart disease is caused by diabetes. So diabetes has a role in a lot of things. People with diabetes have more cancer, they have more heart disease. So the best thing to do is to try to get everything controlled as much as possible.
And kidney issues usually too, right?
Kidneys and feed and all kinds of stuff.
Okay,
from all that sugar sticking to everything.
All right, so again, this is about preventing heart attacks by taking care of your diabetes.
Well, it's not just that, because there's lots of risk factors for heart disease. So the first one, of course, is look at your family. Do people have heart attacks early? Do they have it before they're 55? Especially women having heart attacks early. Genetically, that puts you more at risk too, because women usually have heart disease later than men. Once they lose the protection of estrogen, then they're more likely to have heart attacks. Women with diabetes, though, have heart attacks about the same age as men. So it accelerates their risk. But heart disease, it kills 370,000 people a year in the United States. So, and then the heart attack incidence is 735,000 Americans will have a heart attack every year. And most of those, 2/3 of those are the first heart attack. So we'd like to not even have the first heart attack.
Right.
The highest rates are in the South, and the lowest are in the West.
Well, and we have watched medicine respond by upping their game in terms of time. How quickly somebody gets help is noted now as being a surefire way to help survive a heart attack.
So what you want to know is what are the warning signs, because I think people ignore things or they attribute to something else, or but of course chest pressure, not just sharp pain, but pressure on your chest like an elephant sitting on your chest. I think there's a commercial about some kind of asthma drug, but they have an elephant, sitting on your chest. It's a pressure sensation. People with diabetes may not have that. They may just get short of breath or sweaty or feel really tired. Women have different kinds of symptoms. Sometimes it's jaw pain, sometimes it's arm pain, and it gets worse with activity and it gets better with rest. So if you have chest pain when you're doing any kind of activity or you're stressed, then you need to make sure you don't have any problems. And they can if they pick it up early, they can usually fix it, the blockages in the arteries.
Does a heart attack occur under certain elements for a diabetic that may be different for other people? I mean, there's certain situations, sugar spikes or anything like that, or
sugar being high. I mean, it's hard to know. Low blood sugar is probably more of a risk because it increases adrenaline that speeds up the heart. So anything that's speeding up the heart requires more blood flow to the heart muscle. So if you speed up the heart anyway, like you're stressed out or upset or exercising, but stress is usually worse because stress has more negative hormone effect. So it's going to be more of a risk if you're stressed, and stress is one of the causes of heart attacks as well. But low blood sugars increase adrenaline. Adrenaline would speed up the heart, and it's a stress on the body. So you'd worry about low blood sugars causing that. A lot of times people don't check their blood sugar before they go to bed, or they don't know what their blood sugar is, and the heart attacks tend to occur real early in the morning when all the stress hormones are secreted. So
Really?
2 to 3 a.m. is sort of a prime time. So you'll make sure your blood pressure is controlled. Not that you need to get up at 3 a.m. to check it, but just over in general, like first thing in the morning, if your blood pressure is high, you worry about it being high starting early in the morning.
All right, well, more to come in just a moment here with Diabetes and Endocrinology Consultants bringing you Sugar Talk with Dr. KG. Consultants brings you Sugar Talk every Monday morning with Dr. KG and Lucas, and we're talking about preventing heart attacks and its relationship to diabetes. You think it's 70-80% of diabetics have heart disease, or even higher?
I think you're just assuming you try to
assume?
control all the risk factors.
Yeah.
You're assuming you're at high risk if you have diabetes, especially family history and the other risk factors we talked about. But not everybody with diabetes has a heart attack. It's just you need to make sure everything's controlled. So the diabetes is controlled, blood pressure, cholesterol. There's recommendations to take low dose aspirin that sort of helps keep any clots from forming in the arteries. You want to take your medications for sure. If you've already had a heart attack, then you try to prevent other ones. So you're at more risk, of course, if you've already had one, that you need to be monitored frequently for recurrence or a problem like that. So that's what you need to do for that. And then, of course, lifestyle changes help everything. You know, eating less saturated fat, eating less starches and sugars, and keeping your blood sugar controlled, exercising, not smoking. Those things all help a lot of different diseases.
Now, sometimes we hear about people having bypass surgery and then they get right back to work. You know, it's like this macho thing. They got to come right on back, and they then have another heart attack.
Well, you just really want to try to modify it. Usually that gets people's attention. They start doing really well for a while, and then they get slack again. So I think bypass surgery is a major deal, and a lot of people, you know, just get converted into a good, healthy lifestyle after that.
But you mentioned stress several times, so reducing stress factors in your life.
Yeah, and you can't make stress go away, but you can manage how you deal with it. I mean, how do you deal with stress? Are you one of those people that gets excited about every little thing and all tense about everything? You just have to calm down.
Yeah. Some people are, you know, real highs and real lows in that stress.
But I mean, most things are not important, and you just have to figure out what's important and what you really need to deal with, and you can deal with things without getting emotional and upset about it, or screaming and yelling.
Diabetes School real quickly.
Diabetes School, April 9th, coming up. Swansboro Rotary Civic Center. There's one in New Bern on June 4th, and one at Aquarium at Pineville Shores on October 15th.
Go to beachdoctor.com to find out more, and join us next week for Sugar Talk.
Thanks.